Well, it's a very difficult and challenging time at the minute, obviously. I mean, the GP committee is in dispute with the government over the changes to online access.
Really, all this comes down to is patient safety. So I think people are over the wording. We're now just wanting government to work with us on what's happening now with patients. And the survey we did, over 1,200 practices came back to us in just over a week. You're almost 15 million patients worth of practices across the country with really clear data, with some really excellent qualitative data sets. And that's what we'd like to sit and go through with government to help them understand, actually, we've got this, how can we make this a success? How can we make it safer for patients and feel much safer for practices and the well-being of staff as well? Isn't that a better place to be in than this adversarial point scoring? It feels reductionist and it feels like it's very much not in the interests of practices or patients. And it's all going to come to naught fundamentally because, as I've said before, if you open another lane in the motorway claiming, isn't this marvellous, you can get to your destination more quickly, but actually you get onto the motorway and you realise it's all jammed as well. And actually they didn't widen the motorway. There's no difference. And the public and patients will get that because they're at risk of taking what should be or what could be a good news story about how phenomenally adaptive general practice is and trying to turn it into this binary black and white anti-BMA. I don't see how this is going to work out long term for Wes Streeting. He might feel that it's doing really well at the moment, but I do worry longer term. I think it's going to come back. And we're still going to be here. We're still going to be here wanting to have those conversations and wanting to keep practices safe.